It was game 4 of the semifinals. I just remember trying to go get the ball, and then I knew what just happened. I knew I tore my Achilles. Everything in my basketball career flashed in front of my eyes. I never thought this would happen to me. I remember waking up from surgery. The doctor prescribed me opioids, and after taking it, it made me feel worse than the actual pain on the surgical site. Fast forward to the 4-week mark, introducing 50% weight bearing, and that's when we had a conversation about JOURNAVX, non-opioid medicine for moderate to severe acute pain in adults. JOURNAVX helped me relieve my pain at that time.
Do not take JOURNAVX if you take certain medicines that are strong inhibitors of an enzyme called CYP3A. Ask your healthcare provider if you are not sure. Please keep watching for full important safety information.
Next couple days, you could tell his pain level was coming down, significantly. And I think it gave him confidence that we have a good way to manage his pain.
As a parent, I was actually really relieved that the doctor was able to prescribe JOURNAVX, a non-opioid option for pain management, so that Jayson could focus on recovery and treatment.
You don't try to look forward to the day that you come back and play. You look forward to the day that you get your stitches out. And then you look forward to the day you can put weight on it. You look forward to the day that you can start walking again. Just every single day, just try to find something that gives you hope. It's no fun to deal with an injury like this or deal with pain. And I just hope that people can learn from my situation and my story that they should be able to talk to their doctor and go through their medical history and find out what works best for them. Because that's what I did, and took JOURNAVX and it relieved my pain. I'm Jayson Tatum, basketball world champ and a proud JOURNAVX partner. Where pain starts, JOURNAVX begins.
What is JOURNAVX? JOURNAVX is a prescription medicine used to treat adults with moderate to severe short-term acute pain. It is not known if JOURNAVX is safe and effective in children. Important safety information. Do not take JOURNAVX if you take certain medicines that are strong inhibitors of an enzyme called CYP3A. Ask your healthcare provider if you are not sure. Before taking JOURNAVX, tell your healthcare provider about all of your medical conditions, including if you have liver problems. People with liver problems may have an increased risk of getting side effects, are pregnant, or plan to become pregnant. JOURNAVX may temporarily reduce the chance of females becoming pregnant while on treatment. Are breastfeeding, or planning to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking JOURNAVX with certain other medicines may affect the way JOURNAVX and the other medicines work, and may increase your risk of side effects. Ask your healthcare provider or pharmacist for a list of these medicines if you are not sure. Especially tell your healthcare provider if you take hormonal birth control medicine, contraceptives containing progestins other than levonorgestrel or norethindrone, as they may not work as well during treatment with JOURNAVX. Use non-hormonal contraceptives, such as condoms, or other forms of hormonal birth control during treatment, and for 28 days after you stop taking JOURNAVX. Medicines that are substrates of the CYP3A enzyme, as they may become less effective during treatment with JOURNAVX. Your healthcare provider may need to adjust the dose of your medicine when starting or stopping JOURNAVX. What should I avoid while taking JOURNAVX? Do not take food or drink containing grapefruit during treatment with JOURNAVX. What are the possible side effects of JOURNAVX? The most common side effects for patients treated with JOURNAVX included itching, muscle spasms, increased blood level of creatine phosphokinase, and rash. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all of the possible side effects of JOURNAVX. Call your healthcare provider for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Please see full prescribing information, including patient information, at journavx.com.